The Portable Neuromodulation Stimulator, or PoNS, is a new therapeutic intervention that leverages neuromodulation mechanisms to promote neuroplasticity for improvement of balance and gait deficit in people with certain neurologic disorders. The PoNS device is to be used while performing physical rehabilitation therapy, according to a specific 14-week program, designed to facilitate a regular and consistent treatment. During PoNS rehabilitation, patients perform their physical program combining exercise sessions in clinic and at home. In line with the standard of care for functional balance and gait deficit, patients require an initial consultation with a physical rehabilitation professional. During the first 2 weeks, patients bring the PoNS device to the clinic on the first day of PoNS therapy. The therapist activates the controller and instructs on how to use the device and perform the recommended physical exercises. The therapist will, then, establish the need and frequency of supervised visits, in clinic or virtually, over the first 2 weeks, based on patients' ability to learn and exercise independently. During this treatment phase, patients are encouraged to perform the assigned exercise routine, at least once, at home, in addition to the supervised session. After the first 2 weeks until completion of the 14-week program, patients perform the rehabilitation program independently at home, following up with the therapist, from time to time, to assess progress or exercise training adjustments, and, occasionally, returning to clinic for data capturing. As for every medical treatment, dosing is important in ensuring a meaningful therapeutic effect. PoNS therapy dosing is measured in minutes of device utilization, while performing the physical exercise program recommended by the rehabilitation therapist. Patients with balance and/or gait deficit should perform PoNS therapy regularly and consistently, in morning, afternoon, and evening sessions, placing the mouthpiece on the front of the tongue and activating the controller, for an average of 80 minutes during the gait and balance exercise sessions, 20 minutes for each session twice a day, and, subsequently, once a day for 20 minutes during a breathing and awareness session, over the 14-week treatment period. The full body of clinical evidence shows that PoNS therapy's efficacy is closely related to a consistent performance of daily exercise and relaxation tasks, in clinic and/or at home, for an average of 100 minutes of PoNS device utilization daily.